Cervical fractures are common in traumatic patients, and X-ray is a common imaging modality that you will see in a lot of trauma patients. In this video, we'll go through the normal cervical anatomy in a cervical X-ray and how to interpret this imaging. I am Mohammed Raz, and this is your knowledge platform about the brain, spine, and beyond. First of all, what are the views that we can get of the cervical spine? The most commonly used ones are the anteroposterior view, or the lateral view, or the open mouth view. And each one of those, you will have to look into specific things. Let's see. Before you look into the X-ray, you have to think in a structured way so that you don't miss anything on the scan. Simple way to think about this is ABCs, which basically an A refers to the alignment of the spine, B refers to the bones, where you look at if there is any fracture within the bony structures itself, and then the cartilage, and finally the soft tissue. Let's have a look on the normal AP, lateral, and open mouth view and see how can we see those things. So as you can see in this image, this is a lateral view of the cervical spine. And the first thing to look at is the alignment of the spine. How to do that? By looking into the lines of the spine. The first one is the green one, which is the anterior vertebral line, basically making sure that there is no slip of any vertebra above another one. This line is going smooth from the C2 all the way down to the C7 or the T1. And then again, the posterior vertebral line, which goes on the posterior aspect of the vertebral bodies. Similar to that, again, check if there is any malalignment. And then you look at the spinolaminar line, which basically extends all the way through the lamina of the cervical vertebrae. And then the posterior spinous line, which extends on the tips of the spinous processes posteriorly. So all of those has to be continuous and smooth. Any malalignment, that will be easy to see on this image. Another thing to look at on the lateral image is to look for the Atlanto-dental interval. I will explain that more in the anatomy, but basically here we have what looks like a D-shaped structure, which is the anterior arch of C1, and then what looks like a bullet, which is the dens or the odontoid process of the C2. The space in between is called the Atlanto-dental interval. This interval means that the odontoid process is still stuck to the anterior arch of the C1. If that space goes bigger, that means that the ligaments are disrupted or affected, and that space becomes bigger. Normally, it should be less than 3 millimeters in the adult, and in the kids, it should be less than 5 millimeters. You can watch my video about the craniocervical junction anatomy, where we explained everything about the ligamentous structures in the neck and the normal anatomy of the craniocervical junction through the link above. So S stands for the soft tissue, where we're basically looking at the prevertebral fascia. If the thickness of the prevertebral fascia is increased, that means that the tissue might have soft tissue swelling or hematoma, which entails injury to the cervical spine. Simple way to remember that is to remember C2 is equal 7 and 7 is equal 22. So just two numbers, 2 and 7. What does that mean? That at C2, the thickness should be around less than 7 millimeters, and when you go down to C7, that should be less than 22 millimeters. Let's have a look then on the details of the anatomy on the lateral X-ray. So if we look here, this is, as I said, the D-shaped structure, which is the anterior tubercle, which is the anterior, represents the anterior arch of C1. Then we have the C1 posterior arch. Then that's the posterior tubercle of the C1. This is what looks like a bullet, which is the C2 body and the odontoid, and the odontoid is going all the way up to within the spinal canal and stuck with the anterior arch of C1. This is the pars of C2. This is a C3 lamina, and this is the facet joint between C3 and 4. Similarly, if you go to the next level, that would be C4-5 facet joint, C5-6, C6-7, 6, 7, and so on. This is C4 vertebral body. If we go from above, this is C2, C3, 4, 5, 6, 7, and so on. That's the spinous process. Similarly, from all the way from C1 all the way down to C7 and T1, you can see all the spinous processes. And this is the articular facet of the or articular pillar of C6. Then looking at the AP imaging. So as you can see here, this is the articular line and all of the transverse processes on the left side. This is a facet joint of C4-5. Again, you can appreciate that on the level below and so on. This is the spinous process in the middle, again on the level below and the level below and so on. And this is the C5 lamina. Here is the uncovertebral joint, and this is the body of the C6, and this is the uncinate process. Don't worry much about this bit. And this is the C7 transverse process where it's kind of pointing downward, and this is the T1 transverse process as it's kind of going up. And here you can see the projection of the odontoid peg, which is better seen in an open mouth view, because you can see here we cannot appreciate this at all. So that's why you need to get an open mouth view. This is an open mouth view of the cervical spine, where you can appreciate the C2 and the part of the C1. So you can see here, this is the C2 odontoid process, and this is the body of the C2. Here we can see the C1, C2 articular facet. And then laterally here we have this line which extends between the C1 and C2 laterally to the facet, and here this should be a straight line. If there is an increase of that line, this means that there is an overhang of C1 on top of C2, and this shouldn't be more than 7 millimeters. Again, we described that in my previous videos. Have a look at those videos of the C1 and C2 fractures through the links above. Now you can appreciate how to interpret the cervical X-ray. In next videos, we will also look at the different types of fractures on the X-ray or the CT, so that you can appreciate the difference between the normal anatomy and the fractures. Stay tuned for the next video.